I want to welcome you to an online class on Introduction to Biostatistics. It is important that we understand what statistics is and what biostatistics is. Biostatistics is a sub-discipline of statistics and is a very important course that is required in medical sciences, in biological sciences, because you are handling data that has to do with health of not just the patient, but of all the populace. So when you talk about statistics, statistics is simply a science that handles data, the process whereby you collect data, you summarize and code the data that you have collected, you present it in a way that it becomes meaningful, and you interpret and analyze this data in a way that your populace or those that will come across the data will use it in making meaningful decisions. Okay? The difference between biostatistics and statistics is that statistics is the broader field of mathematical sciences that handles this data. But when this data has to do with health related information, then in that case, it is biostatistics. And it's important we understand that biostatistics is very important in every area of medical sciences. Whether you are a nurse, you are a doctor, or you are a medical lab scientist, or you are a public health specialist, or you are a geographer, you need the knowledge of biostatistics because it helps you in manipulating data and making meaningful decisions that will improve the health of your patient. Okay, let us look at what statistics is. Statistics simply is a science that has to do with how you use scientific method to manipulate data. What is data? Data is simply raw information that is unprocessed, which can be in the form of number, character, or symbols. You get this data from feed, and after you have collected this data, you have to process this data by either coding or summarizing them. You present them, and you analyze this data and you interpret it. So it's important we understand that biostatistics is a sub-discipline of statistics. So if you want to make a meaningful judgment as a clinician or physician, you need the knowledge. Take for example, you have a patient that you want to estimate their blood pressure. You need to at least repeat that procedure twice or three times when the first reading or first values are suspicious, so that you take an average of the values. That is because you know that such information would mislead either the doctor or patient. So in that case, the knowledge of biostatistics can be applied in that regard to make a decision will not harm your patient. Okay, so when you talk about statistics, what comes to mind that is the field of mathematics, though other areas of disciplines, study statistics. But when you are talking about statistics, it's actually a field that is domiciled in mathematics. But the other sub-disciplines, for example, is the biostatistics, which we call biometry, which we can also call biological statistics, or we call medical statistics, or health-related statistics. All these points to the fact that they handle data that is health-related. So the concept of biostatistics is very important, be it that you are either studying descriptive statistics or inferential statistics, because they are health related. Okay, in this our class, we'll be looking at the two types of statistics. Before we look at these two types, what the word statistics, where is it coming from? It is a Latin word, state, because the knowledge emanated from government using data, okay, in their day-to-day activities, both for taxation, both for census enumeration. So there arose the need for this data to be managed. Okay, and the government has often, employed this, and for that reason, it was coined from that word state. So, and looking at the two types, you agree with me, depending on the nature of data you want to organize or you want to manipulate. Okay, we have the first, which is descriptive what? Statistics. It provides us the avenue, okay, to summarize data from complex and massive information Okay, it can be used to categorize people's information, either their personal demographic data, or to seek for information about an object or an entity which you want to know about. You want to know the age, you want to know the sex, you want to know the marital status, the educational status, or educational information of your subject, you can use descriptive statistics. Okay, so it is used virtually for preliminary data. Okay, and you can also use it because it is not as complex as the inferential statistics. What is inferential statistics? It enables scientists to obtain information from a sample and use it to estimate a total population. Because in studying a population, there are some limitations that could, hinder the statistician from making a conclusion with that larger population. So it gives you an avenue to use a subset of a population in analyzing your data. And from that subset data you have, you can now make a generalization that will be used in decision making. So it's important, for example, to use both descriptive and inferential statistics in health related matters, health issues. Try to follow up cases or cohort studies, okay, so that at the end of the day, statistics will make meaning to not just the patient or the medic or the physician, but also to whoever that comes across the data. So from what we have said so far, biostatistics is a scientific process of collecting, collating, presenting, analyzing, and interpreting your data, and using that data to make decisions that will improve health of the populace. Okay, biostatistics is also a discipline that has to improve on health-related issues or health-related sciences. Now, what are the applications of biostatistics? How can it become important to us where we can use this biostatistical knowledge? The first area is when we are making decisions that has to affect our patients or communities where we need to get or obtain data. So there are these data that we obtain, we will make decisions with them such that it will become meaningful to them and for the need for which data is being collected. So also we need the knowledge of application of biostatistics in evaluating or prioritization of healthcare services, especially by government or those that are in power, because when the needs of the populace are much, so they need to bring up a scale of preference. What are the needs of health that are more important than the other? So it is with the knowledge or application of biostatistics that such decisions can help those governmental agencies or those NGOs to make decisions on prioritization. So also we need to apply the knowledge of biostatistics in disease surveillance. Okay, we have different outbreak of diseases and pandemics. So with this knowledge of biostatistics, we can be able to limit it to the barest minimum. Okay, we also have areas like health epidemiology, health services, health policy making, or health management. So we need the knowledge of biostatistics in these areas. Or also we also need the knowledge application of biostatistics in operation of health care services, such as in assessing existing health conditions, such as where and how to bring in interventions to bring remedy or solution to health related issues. We also need the knowledge of biostatistics, or we need to apply it in comparison health indices. Okay, look at the normal population or healthy population, comparing it to those of the health related problem populace, so that at this end we can make adequate comparison that will benefit the health institution. We also have to apply health biostatistics in health projection, when you project health trends, because you have a good aspect or knowledge of biostatistics. We also use biostatistics in health related researches. If you go to different institutions today, at the level of awarding of any degree, you do a research, and that research spans from either the last aspect of the program as undergraduate students, as postgraduate students. You write a thesis, you conduct a research, and you are going to use the knowledge of biostatistics in these health-related researches. So it is good to have or apply biostatistics in this regard. We also can apply biostatistics in what we call population genetics, statistical genetics, in order to make or link variations in genotype or with variations in phenotype. Okay, we can also use the knowledge of biostatistics in ecological forecasting. We can also apply the knowledge of biostatistics in what we call biological sequencing, gene expression or gene transcription. We also use it in system biology, looking at different systems in the body. We can use the knowledge of biostatistics to actually form an array or network of interconnectivity or synergy between these systems, creating pathway of distinction or analysis. We can also use the knowledge of biostatistics in virtually every area or discipline that has to do with health-related institutions. Like I said earlier, we have these biostatistics both in hospitals, both in institutions, or both in communities that are rural or urban areas. You need this knowledge to expand the scope of disease surveillance, improving health-related issues. So the next is, what is the significance? Okay, how important has knowledge of biostatistics been? We have looked at 8 areas where we can apply the knowledge of biostatistics. First, you can apply it in study designs. When you are designing a study or you are designing a treatment plan or health plan, you need this knowledge because it aids in creation of accurate and productive investigations. It offers advice on choosing the right research and design, okay, and the right sample size in order to produce trustworthy, accurate researches from the results or data that you have collected from feed. The second significance is that it aids data collection and managing the data for effective manipulation. By inculcating good and accurate methodology, you can do a systematic research that falls or agrees with existing researches, collect data, manage this data using the knowledge of biostatistics. So another importance of biostatistics is that it has been very crucial in data analysis. As we will be seeing in our subsequent videos, we are going to be having lectures on these 2 types of statistics I mentioned earlier, the descriptive statistics and the inferential statistics. And you do this usually in the chapter 4 of our researches, where we analyze the data we have collected from feed, we present them either in tables or graphs, and we interpret and make decisions that are in line with existing researches or contradicting what has been existing, findings that are already known. So the fourth aspect or importance of biostatistics, it helps in having what we call evidence-based decision making. Okay, it is essential for decision making in the sense that in medicine, the probability of error is very narrow. Okay, so it assists the doctors, the physicians, the nurses, or those that are handling health-related issues in making what we call viable or valid decisions, or in administering the protocol involved in healthcare sectors. From the researches, we make such decisions, evidence-based decisions. We also agree that it is very important that we have the knowledge of biostatistics because of surveillance and epidemiology. Okay, there are different diseases coming up daily, so we need to have a good follow-up of all these diseases, survey areas, map them out, track them. So with this, we can analyze and bring out meaningful epidemiological data in order to spot epidemics, their spread, or their virulence. Okay, we still have the fifth area where we can do what we call risk assessment or prediction. With the knowledge of biostatistics, we can be able to determine the estimate of risk, connect it to conditions and the therapies, and how interventions can help to eliminate or minimize the risk of exposure. So with the knowledge of biostatistics, we can become innovative. Research and development, it has been very crucial in that area, because as a scientist, as a health practitioners, you use the knowledge of these biostatistics in becoming innovative, in providing patent reliable data from your researches. because it helps you in constructing or designing your research, analyzing them, and bringing out a reliable conclusion for meaningful decisions. The eighth aspect is that it helps in quality control or improvement. With the knowledge of biostatistics, it has supported what we call standardization in treatment pattern, in managing of healthcare facilities, to improve patient care and safety, to standardize care, and enable analysis of healthcare data. And also, it has been very crucial in health promotion, successful in bringing out successful initiatives, and to track healthcare outcomes. So with this knowledge, now we are going to be looking at some key concepts that is tied or connected to biostatistics. And one of the very first key aspects is what we call population. When you say population, population is when you're talking about the entire group of individuals or subjects that the researcher intends to study. And in that case, you are looking at not a target population, not estimated population, not homogeneous population, not heterogeneous population, but you are looking at the totality of the persons or your subjects or your patients of which the researcher intends to study. So in that case, it's usually very difficult to cover a full population. However, it is important to reference such a large population. Now, another concept important to the study of biostatistics is what I call sample. Some will say sample size. What is sample? A sample is simply a subset of a population of which you are going to make generalization after the end of the study. So when you talk about sample, you are getting your sample from a population. So it is a smaller representation of a population from which inferences are drawn and generalization can be made at the end. Okay. Now, another concept very vital to biostatistics is variables. What are variables? A variable is a characteristic or attribute that can be among individuals or subjects in a study. Okay, it can be quantitative, it can be qualitative. And examples of such variable, I can say the age, gender, religion, ethnicity, the treatment group, the control group, and so on and so forth. These all can form a variable. They are characteristics of an entity or an attribute. Another important concept in biostatistics is data. When you talk about data, what are data? Data are measurements or observation collected from an individual or group or subject for which a study is being conducted on. So when you talk about data, it is simply an unprocessed information which can be in the form of character, number, or symbols. Okay, data can be of different types. In our next video, we'll be looking at what data is and what are the types of data. Thank you for listening. See you in my next video.